So what can you do? There's lots that we can do, and I think we've talked about that in one of these past webinars, and I think that's an important aspect of all of this. There are a lot of things that are out of our control here, but there are also many things that you can do. And even though there's some really encouraging information that our COVID, the spread of cases is maybe starting to level out and go down. I think the prediction in the medical community is that this is likely to ramp back up again or rear back up again in some months. So we need to be thinking not only about what we can be doing now, but paying attention to what we might be wanting to continue to look after. So going back to those 4 areas, physiologically, what are some steps you can do? Certainly just paying attention to that muscle tension and looking at ways that you can interrupt that a little bit. Even things like just shifting breathing. This box breathing is a way to just, in the moment, if you've got that racing heart, is just slow it down. Breathe in and hold, breathe out and pause. Just that kind of step. Exercise can be a really helpful stress reliever and important for being able to sleep and continue on. And actually that level of disturbed sleep that I noted earlier, keeping a sleep routine or getting back to a sleep routine or looking at steps that can help you sleep better is going to be really important for your health generally, and actually is important for your IBD health as well. And as part of looking after whatever health condition you have, including for those of you here that have inflammatory bowel disease, part of looking after that is keeping connected with your care team or your doctor, particularly if anything changes. What about those feelings, those darn feelings that where there's lots of sometimes more intense emotions right now? So a couple of things to think about is often the way we think about things really drives how we're feeling. And so being able to notice what's going over and over in my head that's leaving me feeling sad or angry. And so part of that's just being aware of. Also a really practical thing, and try it sometimes, it sounds a little bit strange, but it actually can be quite helpful, is rather than worrying all day through the day, is you kind of just say, hold on, at 7 o'clock tonight, well maybe not 7 o'clock, but let me set aside 20 minutes later today, and I'm just going to let those worries come through, come up, but in the meantime, they're going to go in the back burner. So it's a little bit more of hurting, I guess, some of the ways that worry just keeps stewing and putting it in one spot. Also looking at what are the things that you're concerned about, feeling worried about, where you can do something. And then there are many aspects that are out of our control, and that becomes then focused more on, again, how am I feeling and being able to move beyond that. And sometimes it's just things like distracting, connecting with somebody. So those are just touching quickly on some aspects to do with how you're feeling. What about all of those things we may have been changing that weren't so helpful for us in terms of behavior? So this is not specific to COVID, except maybe the one in red there, but a lot of steps that are helpful to do. And I know you've heard it before, but this is the time to be looking at, can I eat, fairly regularly a varied diet with food that's going to be nourishing? What about exercising regularly? Making sure you step back, really watching those items that aren't so good for us and connecting with others. And then if particularly focusing on work and at home, this is the time to be able to let go a little bit, because you just can't do it all. You might be trying to work from home, teach school to your children from home, and so it needs to be, you need to delegate some things at times, or just let go of being able to do all of it in the way you might have before. And I've highlighted the COVID information intake just because, particularly initially, and maybe it's not happening as much now, but initially people talked about having their televisions on all the time. on and also on all the social media. What's next? What can we learn next? And it was information overload. And so looking at doses of information, and again, setting a time, I'm just going to check in once at the end of the day and whatever your favorite place is to get the information, but going to reliable sources. And that can really help with the anxiety that can get ramped up. And what about those thoughts? The way we think about things does really drive how we feel about it, how much our heart is racing or not. So this is just a quick overview of some of what are called cognitive strategies to be able to shift whatever thoughts are stuck in there. And so this is an example of if what's stuck in your head is nothing will ever be the same again. There's ways to step back from that and go, hey, that's just a thought. I mean, we don't know that yet. And in fact, things have changed. And then challenging that thought as well. It's actually exercising up in your mind rather than just letting all of those thoughts and concerns just sit there with you.